going to look at the most basic function of Anaesthetic Pro, and that is the calculation of either a pre-anaesthetic, anaesthetic or pain management dose rate. So we'll come to our layout. If we move down to species, select the species that we want to look at, and this opens a layout that has your pre-anaesthetic, general anaesthetic, pain management or breakthrough pain options. So we'll come back to a pre-anaesthetic. We have an information button, and this gives us general information about the product itself and some of the contraindications that we need to be aware of in dealing with animals that have certain issues. Right, if we come back to our selection, and we'll make ACP Temgesic Atropine our selection. So we're placing in the client surname, the animal name, and its weight. And now we are looking at the actual products themselves. So we have a selection of the milligrams per mil strength of the product. Now this is actually editable, so we can change these values, but we have to be very careful and make sure that they are absolutely accurate. Now we select the milligrams per kg. Now in the case of atropine, if you don't wish to use atropine, that's fine, just select 0. If you're wanting to use it, then select the value that you require. Now we click on our calculate button, and it gives us the actual dose volume of the various products, and it also tells us how to administer that to the patient. We can now print that form off. In this case, we're not too worried about that. Now this brings up another form, and this is actually your emergency dose rate form in case your animal has a problem during anesthesia. Now we can go through and populate this with the various factors that we require. So we're looking at our fluid rate of mils per kg per hour and the actual volume that we're going to administer, because some of these products need to be given as CRIs. There again, we go through and select the various parameters that we need to choose from, and some of these there again are editable. So we just work our way slowly through this form. Once we've completed that, we'll click on our calculation button, and it gives us the various parameters that we require. So we have the fluid rate of mils per hour, how long those fluids will last for, and it also gives us our low and high dose volumes, because in some of these situations we don't necessarily need to give the maximum dose volume. It will also give us a breakdown for treating certain conditions such as bradycardia, ventricular arrhythmia, cardiopulmonary emergencies or respiratory apnea. We can now go ahead and print that form off, so we have it available for us for use during the anaesthetic procedure, and hopefully we don't need it. Once that's completed, we can come up to the top, and we can now print off our anaesthetic monitoring forms. Now this is actually populated with information about the patient and the client, and we can carry on through and enter in the vet, the nurse. We won't worry about this at the moment. And then we look at the procedure, and there again, this is editable, so you can go through and populate this with the various procedures that you actually use within your practice. We can now make a selection on the type of circuit that the animal is going to be placed on, the size of the ET tube, and if it's going to be placed on fluids, the type of fluid that we've got it on. Now once that's all undertaken, we can print this form off. And then the next form that's available is the anaesthetic consumables form, and there again we can select the procedure that the animal's in for, and the other aspects we can fill out once we've printed the form off, just so we have it with us. And it gives us information on materials used, post-operative instructions for that patient, and also the post-operative medication that we are going to place that animal on. So it's just useful information that you need to accumulate throughout the procedure, and we can print that off as well. Once that's completed, we've actually undertaken our calculations, and that's it for now. Thank you.